This presentation is a collective effort by Carolina Mendez, Emily Rose Perkins, Hannah Stiller, Tina Suki, and Alexis Zata. We will be discussing Jefferson County, Alabama's reaccreditation plan.
Jefferson County is located in central Alabama and is home to over 674,000 people. The population is 53.1% white, 43.5% Black or African American, 4.1% Hispanic or Latino, 1.3% Asian, and less than 1% Native and Islander. The leading cause of death is heart disease, which is influenced by factors like genetics, nutrition, tobacco use, exercise, stress, and other environmental factors. The mortality rate has slightly decreased over the last 10 years, sitting at 194.6 per 100,000 population as of 2017. The life expectancy in Jefferson County is slightly lower than the national average, and as of 2013, about 66% of adults and 22.1% of third graders in Jefferson County are overweight. In 1991, the Jefferson County Health Department first adopted guidelines and missions to improve the health of the general public. After launching their first efforts in 2001, and collaborating with multiple sectors beginning in 2007, Jefferson County was the first department in Alabama to receive PHAB accreditation, which lasted from 2015 to 2020. After expiration, the county failed to uphold their status as a result of unknown influencing factors. Various attempts of communication between the research team and Jefferson County have been ultimately unsuccessful due to the COVID-19 pandemic. Through the collaboration of various community sectors, including local and public health departments, healthcare providers, and governing bodies, this presentation is aimed at establishing measurable outcomes via community health assessment, objective clinical data from the community, as well as health and quality of life questionnaires. Our collective goal is to facilitate the reaccreditation process of the county and promote preventative health behaviors in the community.
Using data from government and local organizations, we determined that cardiovascular disease prevention and obesity prevention were the two most important areas of focus based on community need. Based on this, we developed 3 goals and related measures to assist with the Jefferson County Department of Health in reaccreditation while meeting the health needs of the community. Our first goal is to decrease the percentage of Jefferson County residents who are obese and increase the percentage of residents who maintain a healthy weight through promotion of physical activity and nutrition, leading to a healthier community. By collaborating with local healthcare providers as well as health surveys and data from community partners. Our goal is to increase access to quality and affordable healthcare by decreasing the number of people who do not have healthcare access due to cost, transportation, or location, and to provide better services to those who have inadequate healthcare available to them by collaborating with local healthcare providers and the public health department. Our third goal is to provide community education and support for prevention and physical activity by increasing the number of community residents who are informed about obesity and decrease incidence and prevalence of these health issues by increasing accessibility to information about preventative measures and support for residents by leveraging data from community health needs assessments and stakeholder assessments to collaborate with local healthcare providers, the public health department, and many other community partners.
We utilize the balanced scorecard tool to evaluate the Jefferson County Department of Health's accreditation process by applying goals and measures to each of the 4 categories to answer the following questions. From a constituent or programs perspective, how do our constituents within the community view us, and what services or programs are needed in order to better service the needs of the community as identified by the community health assessment? From a process excellence perspective, what internal organization processes have been successful? What internal organization processes could be changed to effectively meet constituent expectations? From a learning and growth or people excellence perspective, what skills and competencies do the Jefferson County Department of Health employees need in order to provide exemplary services for the community? And finally, from a financial sustainability perspective, how can we improve the timeliness and accuracy of data so that it is available to identify and allocate funding opportunities?
Because the Jefferson County Department of Health was previously accredited, our primary recommendation for action is to apply for and to receive PHAB reaccreditation. The reaccreditation process is similar to the initial accreditation process. We have reason to believe that JCDH has maintained their structure and staffing levels in order to achieve reaccreditation, but as their accreditation status expired sometime in 2020, we hypothesize that financial barriers as a result of the COVID-19 pandemic are the primary reason for lacking reaccreditation. As a result, our main recommendation is to show progress on programs and initiatives claimed throughout the first accreditation process, and to work toward creating a sustainable funding structure to support reaccreditation and to prevent future expiration of accreditation status.
As illustrated in our intervention strategy graphic showing workflow and priority of organization, we plan to employ a strategy focus on measure the readiness of Jefferson County Health Department applied to Public Health Accreditation Board. In order to accomplish our goal, it is crucial to put together a multi-sectoral team working with JCDH employees, frontline staff, doctors, nurses, community founders, and strategic staff. By placing different stakeholders into decision-making roles, members of the strategy planning committee will be able to execute the intervention plan effectively and efficiently. Our first priority is ensuring that community health assessment plan and the community health improvement plan are completed, as well as assessing whether the areas of focus from previous plans match the current needs to the community. Based on our data, our areas of focus of Jefferson County are cardiovascular disease prevention and obesity prevention. By keeping track of the plans, we can process and identify opportunities for quality improvement. The collection and evaluation of data and feedback regularly collected from the community will allow us to update and adjust plans as needed. Our multi-sectoral reaccreditation team will collaboratively develop an operational and strategic plan to engage community leadership and achieve goals.
With our comprehensive plan to facilitate the renewal of the JCDH accreditation status, we can assist them in achieving their stated mission, which is, quote, to prevent disease and assure access to quality healthcare, promote a healthy lifestyle and a healthy environment, and protect against public health threats, unquote. Thank you for listening. The following 4 slides include references we use for this project.